You've heard the expression, as you get older, you get long in the tooth. That's kind of like you may be having some gum problems because the bone has shrunk back a little bit. I always think of a periodontal pocket as like stagnated pond. If you've ever seen a stagnated pond where water just kind of runs across the top of it and the bottom doesn't ever mix, that's what I think of when I think of a periodontal pocket, because all that stuff that's down there stays there and you never clean it out. The greatest loss of teeth in the United States and probably the world is due to periodontal disease or gum disease. We start seeing bony changes happen in early 30s that sometimes can lead to tooth loss later on down the road if it's left untreated. When a patient comes in, we take a probe that shows us millimeters, and we're able to place that gently in between the gums and the tooth and measure what we call pockets. A normal pocket is 2 to 3 millimeters, sometimes 4 we might consider normal, but above that we have periodontal disease. So we have to do a special procedure called periodontal scaling and root planing. Sometimes you'll hear them as deep cleanings. I don't like that term because it kind of lessens the severity of it, but we have to go in and clean those pockets out and allow them to heal. Unfortunately, a lot of patients will come in and say, I don't want a deep cleaning or any of that scaling and root planing. That's very difficult for us when you put us in that particular situation, because that is treatment that you need and we can't overlook that. You come to us to take care of your mouth and to provide the best care possible. And sometimes that requires treatment of periodontal disease. But unfortunately, as a licensed dentist, one who has been put out to take care of people's dental health, we can't overlook that. There's a lot of times we might have to have you sign a disclaimer saying that you choose not to have periodontal treatment. We try not to have to do that, but that's the case. But that changes a lot of the treatment on what we can do for individuals. So when we do that, we do one round of the scaling and root planing, but then we want to see you every 90 days. And my explanation to patients as to why every 90 days to have what we call periodontal maintenance, which is a specialized cleaning for gum disease patients, is that the bacteria that cause gum disease colonize after about 90 days. We want to make sure that every 90 days we get in and disrupt that colonization, that multiplication of the bacteria, so that we can break it down to a more manageable level. Sometimes we have antibiotics that we can squirt down into the pockets. There are a lot of different ways that we take care of that. Unfortunately, periodontal disease is not unlike diabetes, heart disease, some of the more chronic diseases that we have in our lives that we have to take care of. So we want to make sure that we're on top of that. Just like your diabetes, you can't go to the doctor once and have it fixed. You have to maintain treatment. Periodontal disease is the same way, because when you have periodontal disease, it's really an infection in your mouth.